Well, thank you everybody for coming to the Bevan Commission. Welcome to our presentation. Sally and I are podiatrists who work for Cardiff and Vale UHB. Sally has a background mainly concentrating on musculoskeletal issues. My background is within the rehabilitation sector and also the elderly population, with my newer emphasis on the health and well-being of staff and patients. We've both seen many changes in the provision of podiatry care, and also the introduction of a robust making every contact count delivery has led our professionals and patients to change the approach to our continued care. Sally and I have been working on this plan for a few years and are very grateful that the Bevan Commission saw in it a worthy project. Originally, we began with the LIPS programme, that's Leading in Patient Safety, which is run by Cardiff and Vale UHB. We were offered the project by a previous manager who had the original idea and needed it taken forward. Rather naively, we thought we would complete and finish in under 8 months. Yeah. Our original aim was to offer an alternative service to our discharged and yet low-risk patients who still require social nail care. Currently, the only provision is private care and some third sector agency help.
Right, hello, my name's Sally. Just to warn you, there's been a few fire alarms, so I hope I don't get interrupted as I'm doing this. There's been 2 so far. They're testing, so hopefully I can get through it okay. So I'm going to talk about PACE, the background. All Cardiff and Vale podiatry patients are assessed for foot health status, and that can be referral from many sources, physio, orthopaedic consultant, etc. All Wales guidelines are used, so we follow the podiatry All Wales guidelines. Approximately 700 patients are discharged monthly due to low foot health need and low medical risk. Currently, the discharged patients are signposted to private podiatry and third sector agencies. And from our research, we believe this is the only service that's been proposed in Wales for podiatry so far. Mo?
So basically, our aim is to offer high quality but simple podiatry care at an appropriate cost to the public. Cardiff and Vale podiatry staff would enable the service to be available to discharge patients and could include weekend and evening sessions. This would help many staff who have child and elder care responsibilities. Advice and education will be offered to the patients appropriately to empower them and to carry on the recommendations started at the original NHS consultation. More recently, we've been investigating how the project could be developed using a social enterprise model. All funds would be reinvested into the podiatry department to improve services and to offer new and emerging treatments. Any deterioration in foot health or medical need could be identified and the patient immediately referred back into NHS care. All case notes would be transferred using the current Paris system, which is our appointments and our case notes and referral scheme. This would benefit the patient by a reduction in repeating information. Appointments closer to home are expected to occur in the community as and when clinics are released back to us following COVID restrictions and the occupation by other health staff.
PACE outcomes, clinical effectiveness. All staff are Healthcare Profession Council registered. NHS clinical governance will be followed by PACE. Disposable instruments will be provided by podiatry department. And using PACE and NHS, we look to provide accurate advice and treatment. Income raised from this social enterprise will be reinvested into podiatry. Health gain, all patients offered health promotion and advice and activation advice as well. Rapid re-access into NHS if any deterioration in foot health, and so reducing GP referral times and waiting times. Enhanced work-life balance leading to staff well-being and improvement in flexible working hours, weekend working and evening work, and looking to reduce health inequality. Okay, Mo?
Sorry. Yeah. Okay, so this slide talks about the population impact and also patient experience. The discharged patients, and it's approximately 700 a month, these are all signposted currently to private practitioners. They are encouraged to look after themselves, but the discharged patients would then be offered PACE, our podiatry accessible care for everyone. If just 50% of these discharged patients took up the offer of NHS staff providing their treatment, there would be a pool of 4,200 patients. We've already made the decision to keep the price competitive so that patients won't be disadvantaged and the health equality agenda is going to be followed. All patients will be fully assessed prior to being offered PACE, and the appropriate care will be accessible to all. Patients with complex needs due to their foot health status and comorbidities will still remain within the full NHS package and receive care in our community. Currently, patients with simple needs identified on their referral are likely to be waiting 12 weeks plus, and obviously this has been impacted by the COVID effect. This would be reduced by triaging the referral and contacting the patient to offer the PACE service. So instead of automatically being offered an NHS appointment, they could be offered a PACE appointment. If at assessment they're found to have complex needs, full NHS care will be initiated. All patients will be seen by NHS staff who are HCP registered and obviously adhere to very strict standards of conduct and strict standards of care. To obtain patient and staff responses to the care when it's up and running, we intend asking for 6 and 12-month feedback surveys to be completed.
Health equality impact. Low costs to enable as many people as possible to take up the option and preventing further foot deterioration. Reduce the gap in health needs by providing an alternative to private care, and linking with third sector agencies will provide care closer to home, such as services like Age Connects. Mo?
Challenges. I think we've all had challenges. Top of the list has been COVID-19, obviously due to reduced protected time due to staff redeployment. There has been a slow start to the delivery of this service, due in part to the reduced time available for project work. Podiatry's had approximately half of its clinicians redeployed to the wards, and this has meant that the remaining staff have been fully patient-fronting. Our staff are now beginning to return and are trying to reduce the backlog of patients requiring care of all complexities. Our Cardiff and Vale Executive Board has had a few changes which has delayed decisions. However, the business planning executive has supported us with our plan, ready for the exec board to contemplate. Cultural and political concerns have been raised at many levels, including the Community Health Council, which looks after the needs and wants and wishes of patients, and also within Welsh Assembly Government. Sponsors such as Chris Martin from the Life Sciences Hub have helped with this, and communication has been fab. The main concern was that healthcare should be seen and should be free at the point of need. However, we were able to allay these concerns by agreeing that healthcare will be free at the point of need and would continue to occur at a medical level. However, PACE seeks to address the patient who requires the more social model of care rather than a medical level of care. Location continues to remain an issue. We are looking at fostering a liaison with Age Connect, a third sector agency, and it's possible then that many local sites could be shared and provide care closer to home across Cardiff and Vale. Originally, we'd suggested our Cardiff Royal Infirmary. It's a central and well-known location to everybody in the area. However, we do realise there could be difficulties with our PACE and full NHS patients using the same facilities. This is an issue that's yet to be fully addressed.
Mo's just covered a lot of these steps, but I'll run through them again. So our next steps to continue with work with Cardiff and the Vale executive team, maintain stakeholder involvement and maintain principles of social enterprise model, establish a connection with Age Connects and possibility of working alongside the podiatry school at Cardiff Metropolitan University. Still trying to establish a location, establish staff involvement, investigate industry sponsors, develop service to include other aspects of treatment, ensure any profits are reinvested into podiatry, sticking to the model of our social enterprise, use feedback to develop and improve PACE for the benefit of the patient, and looking possibilities of franchising this model to other NHS trusts in the future.
So that's our project in a nutshell. Thank you for listening to our projects. We've had ups and downs, as many projects do. However, both Sally and I remain passionate about this idea and would hope to see it in place within the next financial year. The staff within podiatry remain keen to support the endeavour and see the work-life balance aspect as a real positive. We are expecting that Welsh Assembly Government, Cardiff and Vale and the Community Health Council will fully support this venture for the benefit of patients and staff alike. Thank you for listening.